In 2018, the Wits Centre for Health Policy employed a nurse mentor to support community health workers in addressing the difficulties they were experiencing.
There was a bit of a resistance towards me from the community healthcare workers. They thought me coming here, people would get fired, and there will be a lot of trainings. If they fail, they will be taken out of the group. So the resistance was better when I started explaining my role and why am I here, what am I going to do, and how will the team improve.
Nurse Nombumi, who was central to this initiative, spent 18 months on site providing hands-on training and supervision. One of the nurse mentor's key training methods was role play.
So who will be our patient for today, so that you can practice how to do a blood pressure monitoring. The role plays, they help so much because at least they can remember what they are doing in the facility, and then they can correlate it in the location. What do you ask the patient? Is she relaxed?
Yes.
Is she comfortable?
Yes.
Is there any treatment that she's taking yet? What else? I think it's important for CHWs to know it because they are the first people to contact patients in the location. So it's good for them to know the abnormal and the normal so that they can be able to refer to the facility. Sabona mama kunjani? Yep.
I'm benefiting because I do things that I see when people are acting on it.
You ask for permission, right, guys?
And then I get everything that they are acting on it.
So who will be our volunteer? First volunteer? At first they had different personalities. So it wasn't easy. There were those who wanted to stand out. So it's better if you use them first and then you end up using the ones who are shy.
I learned a lot to Sister Mpumi. Bese sisikhohliwe nje ezinye izinto bese sisizenzile.
So they got used to each other. They got used to speaking because sometimes we want them to speak English, read in English, and then you build up their confidence.
I've learned the diastolic and systolic and how to write the ranges of all those things. So I've learned more about that.
Ngoba uzothatha ngisho ibp ubeke ngayo beka kahle ipulse angeke uzuze ukuthi ipulse ihleli kahle. Kumele ubeke kahle bese uzokhona ukuthi le mosheke uzokhona ukuthi ipulse uyayibona ukuthi le ihleli kahle uzokhona ukuthi ibp yakhe ingakanani.
When we do role play, practicing it, they can remember everything that they are doing.
It feels good because it's something that you are doing practically. You see everything.
And it's more effective even when they practice and then we discuss it after. So it became a memorable thing for them. Even during exam, I'll say, remember we did the role play, we discussed it, then you can be able to put it in writing. Seeing people improving in their communication skills, it builds up their confidence also. And seeing them in the facility, you lecture them or you give them information, and then they'll be able, seeing them in the household, practicing that or doing what you have told them. It's really good to see the end results.
The change came in after Wits intervened.
Everything just changed because now we were seen as human beings, let me say.